Good afternoon, everyone. Thank you for joining us today for the Hospice Quality Reporting Program Provider Training Webinar, covering the changes in the Hospice Item Set Manual version 3.00. My name is Rachel Boswai, and I will be your host and moderator today. Our agenda today includes the Hospice Quality Reporting Program, Hospice Item Set Manual version 3.00 highlights, the new HQRP with claims data, and resources, wrap-up, and questions. Now I would like to introduce today's speakers. Ms. Cindy Massuda joined CMS in 1999. Since 2015, Ms. Massuda has been the Hospice Quality Reporting Program Coordinator within the Centers for Clinical Standards and Quality. Prior, she worked on Medicare demonstrations with a focus on hospice and was a project officer in CMS's Office of Research, Development, and Information and Centers for Medicare and Medicaid Innovation. Ms. Brenda Karkos is an Associate Nurse Researcher at Abt Associates. She is a registered nurse with many years of clinical and administrative experience in community health, hospice, and oncology. She is certified in hospice and palliative care and currently serves on the board of directors for the Hospice and Palliative Care Federation of Massachusetts. Before joining Abt, Brenda was most recently the Director of Hospice Program in Massachusetts. Her work at Abt is focused on hospice, oncology, and home health projects. Slide 5 in the slide deck contains a reference list of the acronyms that will be used throughout today's presentation. Today's webinar was designed to provide a general overview of the changes included in the Hospice Item Set Manual version 3.00. At the conclusion of this program, we would like training participants to be able to, 1, discuss the current Hospice Quality Reporting Program and the requirements, 2, summarize the changes from the Hospice Item Set Manual version 2.01 to version 3.00. 3, describe the 3 data sources that will now comprise the HQRP once finalized through rulemaking. 4, name the new quality measure that will be created from data collected via Medicare claims. And 5, locate at least 2 resources to help hospices understand and comply with the HQRP. You should now see the polling question appear next to the presentation on the webinar screen. The question is, in which year did hospices first start HIS data collection for the HQRP? A, 1979, B, 1983, C, 2014, or D, 2020? So let's take a moment for everybody to select their response. And it looks like just about everyone has chosen the correct response, which is 2014. Perfect. Before we conclude today's event, we will provide a final wrap-up and question and answer session. If you have any questions throughout the presentation today, please submit them via the Q&A panel on the right side of your screen. It is now my pleasure to turn the session over to our presenters, Cindy Massuda and Brenda Karkos.
Thank you very much. This is Cindy Massuda, and welcome and thank you for joining us for today's webinar. As you have heard, the focus of today's webinar is to review the changes in the Hospice Item Set Manual version 3.00, as well as to answer some of the questions about the future of the Hospice Quality Reporting Program. So let's start by briefly reviewing the Hospice Quality Reporting Program. The Hospice Quality Reporting Program promotes the delivery of person-centered, high-quality, and safe care by hospices. The Hospice Quality Reporting Program is required under the Social Security Act. CMS hopes that hospice providers will use the HQRP data as part of their QAPI programs to encourage continuous performance improvement. Through the Care Compare website, consumers can use this information to locate hospices and to compare performance in order to find the hospice that is right for them by accessing publicly reported quality information. The link to Care Compare is listed on the slide. Currently, there are two requirements for the Hospice Quality Reporting Program: the HIS data collection and submission, and the Consumer Assessment of Healthcare Providers and Systems, or CAHPS, Hospice Survey. All Medicare certified hospice providers must comply with these two reporting requirements for all patients, regardless of the payer. The graphic on this slide is probably very familiar to you. It displays the two components of the Hospice Quality Reporting Program, or the HQRP. To meet the Hospice Quality Reporting Program requirements, hospices must comply with both components of the program, the HIS and CAHPS Hospice Survey. And so we show it as this equation: HQRP equals HIS plus CAHPS. By meeting these requirements, hospice providers will avoid a 2% reduction in their annual payment update, or APU. For a hospice provider to be considered compliant, timely and complete data must be successfully received and accepted by CMS. And I just want to note that about the 2%, that beginning in fiscal year 2024, the payment penalty changes to 4% reduction in the annual payment update. The activities for the Hospice Quality Reporting Program are on a cycle, and the cycle spans over a 2-year period. This graphic depicts the cycle and summarizes a lot of information. So I'm going to take a minute to report some of this important information. The Hospice Quality Reporting Life Cycle shows how the calendar year data submission impacts future fiscal year hospice payments. So to appreciate this graphic, let's start at the far left. The first section is blue, is showing the hospice role in data collection and submission during one calendar year period. That is January 1st through December 31st. So in this graphic, we're showing January 1st, 2020 through the end of the year, December 31st, 2020. The compliance determinations for last year will occur during the first half of 2021, which is the next calendar year. As you can see from this graphic, we are now in the green section next to the blue, where it states CMS compliance determination. After the first half of calendar year 2021, in this example, the non-compliant providers will be notified. This is shown on the graphic by the dark green line. The line pointing to this says CMS sends non-compliance letters. Non-compliant hospices are notified two ways: by their MACs with a letter, and a letter is placed in the provider's CASPER folder. Either letter is considered official notice. This notification typically occurs in the early summer. Now, let us look at the light blue area that says non-compliant hospice completes reconsideration request within 30 days. Any hospice deemed as non-compliant has 30 days once notified to file a reconsideration request. The very light green says CMS delivers reconsideration results. This means that before the start of the fiscal year, which starts October 1st, CMS provides the outcome of the reconsideration request to any non-compliant providers who submitted a reconsideration request. In the last green section on the right, the payment impact occurs at the beginning of the fiscal year. So for this example, that would occur October 1st of 2021, which is fiscal year 2022. So to summarize, this graphic shows how quality data submitted during calendar year 2020 impacts the future fiscal year 2022 hospice payments. Any provider found non-compliant with the Hospice Quality Reporting Program will receive a reduction in their annual payment update in the corresponding fiscal year. The reduction is currently 2%, but starting with fiscal year 2024, that reduction is 4% payment reduction in your annual payment update. You can find a lot more detail on the CMS HQRP website. So let's move on to how CMS uses this data. CMS uses the HIS and CAHPS hospice survey data to calculate a hospice's performance on quality measures. CMS then publicly reports these quality measures on the Care Compare website so that consumers can compare providers in their service area when selecting a hospice. I will now turn over to Brenda to complete this section.
Hi there. Thank you, Cindy. So Cindy mentioned Care Compare, and this is a streamlined redesign of the original 8 CMS Healthcare Compare tools. Hospice Compare, one of those tools, was retired on December 1st, 2020. And like the original Hospice Compare tool, consumers can select and compare multiple hospice agencies based on their quality measure information. The link to the Compare website is also listed on this slide. So this is just a screenshot of what the home page looks like for Care Compare. You can start by selecting the provider type, and then you can put in a location by zip code or city. Once selected, a list of area hospices will come up for you. And from there, you can choose up to 3 at a time to compare the information and compare their quality measure results side by side. So here's an example of what just one of the quality measures looks like on Care Compare. This sample is showing 3 different agencies and their scores for just the hospice and palliative care composite process measure, comprehensive assessment at admission. And you can see in the first box that it describes the measure, and then it shows you the national average, which for this measure is 88.7% on the example we have here. And you can see that one hospice is fairly low, but the other 2 are almost 100%. So right now, the HIS-based hospice quality measure is the Hospice and Palliative Care Composite Process Measure Comprehensive Assessment at Admission. This measure shows how often a hospice completed all 7 HIS care processes when a patient was admitted to hospice care. The 7 HIS-based QMs are grouped into 2 categories: patient preferences and managing pain and treating symptoms. And you can also drill down further to see the results for each of the individual measures that make up this composite on the Compare website. So now let's look at the CAHPS Hospice Survey-based quality measures. Care Compare displays 8 CAHPS measures that have been created from the caregiver survey results. They can be found under the Family Caregiver Experience. You can see here the list of what's displayed, but I'll read them just for a quick review. So the first one is communication with the family, then getting timely help, treating the patient with respect, emotional and spiritual support, help for pain and symptoms, training the family to care for the patient, and then 2 overall measures, rating this hospice and the willingness to recommend the hospice. Now let's just take a brief minute for a polling question. So which of the following statements about the HQRP data is false? Is it A, data is used to determine compliance with the HQRP, B, the data is used to calculate quality measures, C, the data is not used by CMS, or D, CMS uses HQRP data to promote the delivery of person-centered, high-quality, and safe care by hospices? It looks like most of you have answered C. And if you answered C, that is correct. It's a false statement that CMS does not use the data hospices submit. They use it in many different ways, as you can see on this slide. Okay, so let's get to the main content of the webinar for today, and that's about the detail and the highlights for what's changed in the HIS manual from version 2.01 to version 3.0. The manual was finalized in February after receiving OMB approval. So the Hospice Item Set Manual version 3.00 can be found on the CMS HQRP website on the Hospice Item Set or the HIS webpage. The link to that page is listed here. The new manual has been updated to reflect the removal of Section O and its associated measures. This new version, along with the related documents, can be accessed in the Download section of the HIS webpage. And there's also a change table that summarizes these changes for you, and there are copies of the HIS admission and discharge documents. So let's do a quick review of how the manual is set up and what's included. The contents of the manual is set up in 3 different chapters and appendices. So Chapter 1 gives you the background and overview. It explains how the HIS was established with the intent to collect quality data for hospices with a standardized set of items. Chapter 2 will provide you with the item-specific instructions This chapter presents each item in the Hospice Item Set along with instructions for completing the item. It's organized to correspond with each section of the HIS, and it gives you some tips and examples as well. Chapter 3, Submission and Correction of HIS Records. So this chapter gives you the detail on the submission and correction process for HIS records and the requirements for data submission by hospices for the HQRP. And lastly, in the appendices, it includes a variety of information such as the acronym list, a glossary, the HQRP resources, the admission and discharge assessment documents as well. So I mentioned that there's a manual change table that's also posted with these documents on the page. And this document describes the major changes. It outlines the revisions by chapter with explanations of exactly what's changed. The link to the change table is listed here, and it's also in the resource section at the end of the training as well. So this next slide gives you an overview of the changes we're going to review in detail. So first is the removal of Section O from the discharge assessment. There's the HIS quality measure details will now be found on the HQRP user manual. The updates to the HQRP reporting dates and years have been updated. The anticipated transition to iQIES, which is the Internet Quality Improvement and Evaluation System, and that's referenced in the new manual. And the address for the technical help desk has also been updated. So I mentioned that the major change to the new manual is the removal of Section O. And this is the data that was associated with the measures for hospice visits when death is imminent, or HVLDL. CMS will now obtain the data they need from administrative data that already exists. And in this instance, it's the claims data. One advantage of using claims is that it's minimizing the provider burden. So there's no need to continue to collect this information through the clinician assessment. Okay, let's go over a little background about Section O, just to be clear for everybody. So Section O was added to the HIS Discharge version 2.0 back in 2017. And was originally specified as a set of 2 measures. These measures were designed to capture visits by hospice staff during the last week of life, when patients and caregivers typically experience higher symptom and caregiving burdens. So Measure 1 collected information about registered nurse and physician visits, and Measure 2 was designed to collect information for social work, chaplain, LPNs, and hospice aide visits. And hospices began collecting this data in April of 2017. So these are just the screenshots of the items that have now been removed from the assessment, the discharge assessment. And these include the number of visits provided by the different disciplines in the final 3 days, and then the number of visits provided in the last 3 to 6 days prior to death. The quality measure related to Section O has been publicly reported since 2019, and this was for Part 1 of the measure only, the clinical hospice visits in the final 3 days of life, including visits by registered nurses, physicians, nurse practitioners, and physician's assistants. Measure 2 was never publicly reported because it didn't meet CMS's readiness standards for public reporting to distinguish between high and low quality hospices. This was a measure for hospice visits in the final 7 days of life, including visits by the medical social workers, LPNs, chaplains, and the hospice aides. So some hospices have already inquired, through the hospice help desk. They're asking, what they need to do now. Basically, the new HIS discharge assessment no longer includes Section O, and hospices can remove that section from their data collection tools if they would like to. Providers who wish to maintain it can certainly collect that information, but that data should not be sent to CMS. If Section O data is submitted to CMS, it will be ignored by the system based on the target date, and links to the new assessment forms can be downloaded from the HIS page on the HQRP website, and those are links are listed here on the slide. So we've covered the changes with Section O, but I'd like to quickly run through some of the other changes that have been made in the manual. The previous manual included a table that listed the quality measures calculated from the HIS items, and that table has now been removed, and all of that quality measure information will now be found only in the user's manual or on the current measure web page. And you can find the link to the QM user manual on the current measures web page in the download section. And the link is also on this slide. Some other changes are that the table that reflects the reporting years has been updated for fiscal year 2021 and 2022. And the calendar year 2020 data impacted by COVID-19, the public health emergency, is also mentioned in the new manual. So just a bit more detail on the changes regarding the impact of COVID-19 and the resulting impact on the HQRP requirements. Data collection and submission for quarter 1 and 2 of 2020 were exempted. So that's January 1 to June 30th of 2020. Compliance determinations will be based on the HIS submissions for patient admissions for quarter 3 and quarter 4 of 2020 only. And those calendar year 2020 data will impact the fiscal year 2022 payments. So the information on this slide is just to remind you about some of the COVID-19 materials that do exist. In 2020, CMS produced 2 important tip sheets related to the COVID-19 PHE and the exemptions as well as the impact on public reporting. And these 2 tip sheets can be found in the download section of the HQRP requirements and best practices webpage, and both of those links are listed here as well. So lastly, the manual mentions a change to the Quality Improvement and Evaluation System, or the HQRP system, that will be coming soon. Although we don't yet have an actual date for hospice, it's anticipated that the current system will transition to iQIES in 2022. Other post-acute care settings are already using the iQIES system. The references in the manual to keys and assessment, submission, and processing, or the ASAP system, are valid until this transition takes place. However, the KEYS Technical Help Desk email has already changed to iQIES@cms.hhs.gov, so please make note of that change. We have had some inquiries where people were using the old help desk address. In addition, when reports migrate to the new iQIES, they will no longer be referred to as CASPER reports. Now let's go to one more polling question. So the changes to the HIS Manual version 3.00 include the following, except A, the removal of Section O on the hospice discharge, B, updates to the process for correcting HIS records, C, future transition to iQIES system for HIS submission, and clarification of changes to HIS data collection and submission due to the COVID-19 PHE. Okay, and it looks like most of you have chosen B. And if you chose B, that is correct. Updates to the process for correcting HIS records. There have been no changes or updates to the process for correcting records. That remains the same. So I'll turn it back over to Cindy so she can talk us through a little bit about the future vision for the HQRP.
Thank you, Brenda. CMS continues to look to the future and plans to improve the Hospice Quality Reporting Program. Let's take a few minutes to review these enhancements that we've been working on. CMS is currently testing a new patient assessment instrument called the Hospice Outcomes and Patient Evaluation, or HOPE. The goal for HOPE is to be more comprehensive by capturing patient and family care needs in real time and patient information throughout the hospice stay, not just on admission and discharge. HOPE will incorporate data from the HIS when it is launched, and in time, HOPE will become the one assessment tool for the hospice industry. Integrating HOPE and administrative data. So we have talked about the hospice visits last days of life, or HVLDL, and how data that data that was used in Section O will now come from our administrative or claims data. So the HQRP, once finalized through future rulemaking, will eventually include administrative data like claims, and HOPE, which will include the HIS with CAPS, the CAPS Hospice Survey. So this graphic just depicts the components that will eventually be what we're planning for the future of the Hospice Quality Reporting Program. I would like to take a minute to explain why we're including claims-based measures. Other quality reporting programs include claims data and claims-based measures. This is because the administrative data or claims are readily accessible, and the use of claims data minimizes provider burden by removing the needs for hospices to collect the data through clinician assessment. In the case of the hospice visits when death is imminent, this was in Section O. So now the hospices with using claims data do not need to submit that information, and they have the additional benefit that the data submitted by claims results in hospices being 100% compliant with the submission of the claims data. So now let's talk a bit about the hospice visits in the last days of life, which is referred to as HVLDL. It is a re-specified version of the hospice visits when death is imminent, but is calculated with claims data. This claims-based measure will be referred to as the Hospice Visits Last Days of Life, or HVLDL measure. Relative to its predecessor, the Hospice Visits When Death is Imminent measure, the claims-based version achieves the following. It gives us improved ability to differentiate higher from lower quality hospices. In testing this measure, it produced positive correlation between CAPS hospice survey outcomes, and the quality rankings are more consistent with other quality measures in the HQRP. And this measure aligns, which is a really nice benefit, with the Service Intensity Add-on, or SIA, for hospices. I would like to end with what HQRP compliance will look like in the new Hospice Quality Reporting Program and the benefits of using claims data. Data collected will still run from January to December for each calendar year, and hospitals will receive their full annual payment update for the corresponding fiscal year. So what hospices will need to submit is their HIS data, which has the 90% submission rate for acceptance, plus along with that the CAPS Hospice Survey, where you contract with an approved survey vendor and participate monthly for all 12 months of the calendar year, and then claims data, and with the compliance there, that you would be 100% compliant for all hospices. No other action is necessary. And I'm now going to turn it back over to my colleague Brenda for the frequently asked questions.
Sure, thank you, Cindy. So we have received quite a few questions over the last few months, so we thought we would start with these questions so that we can go through some of the answers that we already know, some of the questions that you're going to be thinking or have in your mind. So number one, since Section O is no longer required to be reported, is the service utilization going to be reported anywhere else? So basically, hospices no longer need to submit Section O, as we've mentioned. CMS will rely solely on the administrative data, the claims, for this calculation of the measure, and it removes the need for any clinician assessment or reporting on the part of the hospice. And the data reported for the HVLDL measure will be discussed in the rulemaking, and the rule is currently up there for you to comment on. Question 2. What version of HIS discharge assessment needs to be submitted after January 1st, 2021? So although Section O is no longer required, either version 2.0 or version 3.0 HIS records are still accepted by the ASAP system. On January 1st, 2021, CMS implemented version 3.0 of the HIS data submission specifications. Any admissions with a target date of January 1, 2021 or later will be processed with those specifications. If a provider submits HIS version 2.0 containing Section O with a target date before January 1st, 2021, it will be processed with the version 2 data specifications and saved with the Section O intact. So a third question that's come to us is, how will the HQRP compliance be affected by the removal of Section O? So as Cindy mentioned, since this data will now come from claims, this means that the hospices will be 100% compliant with submission of that information. In order to stay compliant with the HQRP, hospices still have to comply with the HIS data submission, which will be 90% of their data needs to be submitted and accepted in the system in order to ensure compliance. And the hospice caps. All Medicare certified hospices must contract with an approved survey vendor and participate monthly for all 12 months. So where can you find information about the changes from version 2.01 to version 3.0? So the HIS change table will give you the information on those changes from version 2.01 to version 3, describes the major changes, and it can be located on the CMS HQRP website in the download section on the HIS page. And as I mentioned, it gives you section by section and outlines the various changes. It's a real quick reference for you. Okay, so question number 5. How were these last 3 days of life calculated in the hospice visits last days of life? So basically, the specifications for this has not changed since using Section O. It's exactly the same. The calculation of the last 3 days remains unchanged. Specifically, those 3 days are indicated by the day of death, the day prior to death, and 2 days prior to death. So that information that's located in item number A0270, the discharge date or the date of death, would be the day of death. Then 1 day prior would be calculated as A0270 minus 1, and 2 days prior would be calculated A0270 minus 2. So again, this has not changed with the transition. It's exactly the same as you were expecting with Section O. So here's another question. For the hospice visits last days of life measure, are patients excluded if they are only on hospice for 1 or 2 days? And yes, that is correct. Short-stay patients who are only on hospice for 1 or 2 days are not included in these calculations because it only looks at the visits in the last 3 days of life, so patients must receive hospice services for at least 3 days in order to be included in this measure. And where can we find information about the development of the new claims-based measure, hospice visits in the last days of life? So a report describing the respecification of HVWDII, or hospice visits when death is imminent, and introducing the HVLDL can be located on the website. And there's a link here, and there's also another link located in the resource section. But it also can be found on the current measure webpage in that download section. I'm just going to do a quick summary. So in summary, for today's participants, you should be able to discuss the current HQRP and the requirements, summarize the changes from the HIS manual from 2.01 to manual 3.0, describe the 3 data sources that will now comprise the HQRP, which is the HIS data, the CAPS data, and administrative data, which is the claims. And then name the new quality measure that will be created from the data collected from Medicare claims, which is the HVLDL, or hospice visits last days of life. And you should be able to locate at least 2 resources to help you understand and comply with these changes. And I'll go over some of those resources now. So on this page, you'll see there's the HIS Manual version 3.0. There's the HIS Manual change table that we talked about. Then the CMS HQRP main page, where you can get to all kinds of other links for the individual web pages. The HIS page, web page, was listed there as well. Next page, the respecifications report we talked about for HVLDL, and you can find that on that link there or on the current measure web page. Care Compare, that's the link there. And then those two COVID tip sheets that we spoke about, those are the links to those two tip sheets that are in the requirements and best practices web page. And then there's the HQRP Training and Education Library, where you'll find the slides for today's presentation, and then you'll find the final slides about a month from now. But there's also lots and lots of great trainings there. If you haven't looked at that web page, I would encourage you to do so. And then the CMS Hospice CAP Survey web page is listed there, the official Hospice CAP Survey website, and then the document Common Questions, HQRP Claims-Based Quality Measures that we put out in February of 2021. And this graphic just gives you all the different help desks and how to access them. It's a great page to print out and keep at your desk or hand out to your staff if they have questions. So I'll move back to our moderator. Looks like we might have time for some questions.
Thank you so much. Before we conclude today's webinar, we would like to take the time to answer some of the questions submitted through the Q&A panel, as well as give you all the opportunity to ask questions live. If you would like to ask a live question to the presenters, please make sure that you're dialed into the conference using a telephone. From your phone, please press *# to let us know that you have a question, and we will call upon you and unmute your phone line so that you can ask. So let's start with some of the ones submitted through the Q&A panel. This first one is from Christy. Is there any chance the graphs will be added to Care Compare in the future that were present before?
This is Cindy. It's something we can talk to our Office of Communications, who works on that website, the Care Compare website, and gladly bring it to their attention.
Okay. Our next question is from Carolyn. Where are the latest HQRP measures manual with the specifications for the new HVLDL measure?
Cindy, do you want me to answer that?
Yeah, please, go ahead.
Right now, the only document that's posted is the respecification document that I mentioned. The new manual has not come out yet, and it will once rulemaking is complete. So please make sure you take a look at the rule that is currently posted.
Thank you, Brenda. Our next question comes from Jennifer. Why are physician assistants included?
Physician assistants included, can you expand on that? Are you talking in what measure?
We'll see if we can get clarity on that. In the meantime, we'll move to the next question. And this one is from Debbie. Currently, we have to use the Internet Explorer 9 or 10 to submit data. Is there a plan to update the system to allow for data to be submitted with more modern operating systems?
So that's with our technical team, and they are constantly working to make updates there, and if there are updates made, it will be communicated on the web page and on our Spotlight page.
The next one is from Stephanie. Is there any consideration to remove the HIS discharge form completely? The information remaining is generally collected on the claim, and now that Section O is removed, the HIS discharge form seems unnecessary.
So the discharge form is continued to be collected, and it's used for, other purposes related to record matching and for the ability to do, our work we need on HIS quality measures. So it will continue.
Thank you. Next, let's take one from the phone line. The person with the phone number that ends in 7225, we are now taking you off of mute.
Thank you. My question is there a plan to provide reporting of the new visits within the last days of death? Since it's claims-based, we don't have the ability to get that currently out of our software. So is there going to be something in the CASPER, the iQIES system that gives us to us sort of real time?
Sure. So for the claims-based measures, we are going to have them in the QM reports for providers to see, and also in the preview reports prior to any public reporting. And that is our plan for both the hospice visits, last days of life, and as we finalize in rulemaking, if the hospice care index and any future claims-based measures, that is the plan. They will always be available in your quality measures reports and then in your preview reports prior to public reporting.
So since public reporting's on hold right now, but we're submitting the data, is there an anticipated timeline when that data will be available?
So we would be, if you look at the proposed rule that we just published, we're looking at doing the claims-based measures no sooner than May of 2022 for public reporting. So we would then be bringing the data on for your quality measure reports 6 months prior to that. So say it would be in about October of 2021, or is that November, excuse me, November of 2021 would be 6 months prior. So that's when they would be available.
Okay, so that doesn't provide us any ability to use the data from a copy standpoint in the meantime.
No, I mean, just to help, because of we're timing it with public reporting, that's when it would begin in your report.
Okay. So let's take another question from the question and answer panel. This one is from Carolyn. I understand the pro with using claims data from a provider burden perspective and for accuracy and reliability. However, HIS data and soon-to-be HOPE data will be collected for all patients regardless of payer. Medicare claims data is only for Medicare. Therefore, isn't the migration to claims data limiting?
So the claims data, you are correct, is only the Medicare claims data. And while it does only cover Medicare, Medicare is the payer for well over 90% of hospice care in the Medicare certified providers. So it more than captures the vast majority of hospice care and reflective of the program. And that's why we feel comfortable using it.
Okay, thank you. The next question comes from Carolyn. For HVLDL measure, vendors would like to know how claims data is used in the calculation to duplicate it in real time. Therefore, where is the claims-based specification for the HVLDL measure?
I believe that we can make sure it's on the website, but I believe it's on the website, and also when we did the work with the paper with the PRA package, I believe we included it. It's included in there. But I will make sure it's up on the webpage to be sure it's accessible to everybody. So I appreciate that question.
Thank you. Our next question is from Tracy. Will physician visits count in the HVLDL measure?
For the hospice visits last days of life measure, when we did the testing of that measure for validation against CAPS, it was only the RN and medical social work visits that showed good correlation with CAPS data. So that's why we're only using the RN and medical social worker in the measure. So we are not capturing physician visits as part of that measure, as part of the claims-based measure.
Thank you. Our next question is from Lisa. What is the current average of HVLDL obtained thus far by CMS? It would be very helpful to know the target.
I'm sorry, can you repeat that question? I apologize.
Goodness, there's a lot. We will come back to that one. Let me go to the next one. How much advance notice will be given before the Hospice Item Set transitions from CASPER to iQIES?
We will be giving a lot of sufficient notice. I will say at this time, and we have it in the proposed rule, it's no sooner than in calendar year 2022, but we will be giving updates as we get closer to when we're planning for that. But it will be given several months notice as we plan for it. We're well aware of people's interest and anxiousness, or to be ready for this transition to the iQIES, and we'll be working with the industry on that.
This next question comes from Shauna. Section O contains both L3D and L7D measures. Neither information is needed to be submitted as both measures are claims-based. Is this correct?
I'm trying to see where this, can you repeat the question?
Sure. So the question is, Section O contains both L3D and L7D measures. Neither information is needed to be submitted as both measures are claims-based. Is that correct?
You're saying for hospice visits last days of life that we're using the claims-based measure. The only thing we removed from the discharge is Section O. So if it's still included on Section O, it would be expected to be completed.
And circling back around to that last question, it was, what is the current average of HVLD obtained thus far by CMS? It would be very helpful to know a performance target.
Okay. And we can share that. We can share that on an upcoming call with the industry.
The next question is from Anya. What impact will the new HVLDL have to hospices when families do not want additional services? Dying is very sacred, and some families want this to be their time with the patient and not have a nurse or social worker visit.
Sure. So we understand that, but the measure is set up to look for the recognition that in the very unique time where the patient is actively dying, which you can sometimes refer to as like the intensive care of hospice, it's such a unique time that the need that we are trying to identify when visits are needed, and that there are obviously going to be times where patients don't want the visit or whatever, but there are going to be the vast majority of the time those kind of visits are needed, and so that's what the measure is looking at. And so overall, we believe that it'll be, we're identifying the use of that time and care for the patients and families in that measure.
Cindy, this is Brenda. I'd just like to add to that basically this hasn't changed since, compared to the information that they've been collecting on Section O, that I'm sure the same thing existed, that there are patients that refuse visits, and it hasn't changed going to HVLDL.
Thank you, Brenda and Cindy. The next question comes from Debbie. What about non-funded and private insurance patients? CMS would not get those claims to get the number of visits when death is imminent.
This is true, but because Medicare is as I was saying earlier, the payer, well over 90% of the claims data for all of hospice care in the United States, we have the vast majority of the data to report on, reflective of how that measure is functioning in the program.
Thank you. Kimberly asks, does LPN visits count towards the new standard regarding last visit?
So again, the hospice visits last days of life measure includes only the registered nurse and the medical social worker. So LPN visits or licensed practical nurses would not be included in that measure. We're using the RN. We looked at all disciplines for the measure as we were re-specifying it from the hospice visits when death is imminent. And we literally looked at all disciplines, including everything that was in Measure 1 and Measure 2 of the hospice visits last days of life. We looked at every, the LPNs, the nurses' aides, the RN, the medical social workers, the physicians, the chaplains. We looked at every possible discipline that was in the original measure, and then we were validating it against the cap. And when we were looking at it from a claims perspective and we completed all that validation, and that's what's in that technical report that Brenda was referring to that's on our website. That's a very good report on this topic. And what we found is regardless of who was originally in Measure 1, that actually included physicians and physician assistants and nurse and RNs, and what was included in Measure 2 that included medical social workers and other disciplines within the hospice programs, we found that when we did that analysis, that the only disciplines that correlated well with CAP were nurses, RN registered nurses, and medical social workers. And that's why they're the only ones included in the hospice visits last days of life claims-based measure.
Thank you. Our next question comes from Lisa. So either version 2.01 or version 3.00 may be submitted. Is there a date when version 2.01 would be rejected?
At this time, we don't have any date when version 2.01 would be rejected. It's because the system has been set up. When we set in the system with version 3.00, it was set up so that it can accept either version because of technical issues, updates need to be made, and it has the ability to be able to accept, the version 3.00 has the ability to accept the data in version 2.01, and effectively, if it needs to not include or ignore, as I use as a term of art, Section O, it would. but it's for technical reasons. There are times where, you know, people are making updates from prior information prior to our implementation of hospice visits last days of life. So they're making updates, and so we still need to be able to collect information that can be in version 2.01. If there's ever a time where we make any change, we would give notice well in advance, but we don't have plans for that at this time.
Thank you. And again, as a reminder, if you would like to ask a live question to the presenters using your telephone, please make sure that you're dialed into the conference using a telephone, and from your phone, press the star and pound keys to let us know that you have a question so that we can unmute your phone line. Okay. Let's go to another question submitted through the Q&A panel. Renee asks, where can we find the draft HOPE assessment?
It's on our webpage. You're talking about the hospice. Oh, I'm sorry. The HOPE assessment. Excuse me. The HOPE assessment. We are going to. We will probably be discussing it at an upcoming forum that we're having. That you should be seeing on our Spotlight page, announcing it for later this spring. And as we develop, as HOPE is more revised and we can share information, we will be sharing more details about the HOPE assessment instrument.
Thank you. Next question is from Rosemary. When will the next compare for hospice be released?
So we have the May refresh coming up, and in the May refresh, we will be, we will be updating the file with, you know, the zip code file will be updated there, and we will be adding information on related to Medicare, being able to show Medicare Advantage hospices that are accept Medicare Advantage patients, and hospices that accept patients that are Medicare and Medicaid. I think we talk about that. I know we talk about that in the proposed rule, and but the actual data that's frozen will continue to be frozen through November of 2021.
Thank you. Our next question is from Brandy. Prior to signing the discharge HIS, is it still necessary to check the visits for verification with the removal of Section O?
So whatever remains on the discharge form after we remove Section O is expected to still be completed.
Next question is from Melody. Does day 0 or day of death still not count for any visit?
So again, nothing has changed for moving from hospice visits when death is imminent to hospice visits last days of life. So, and I think Brenda discussed it in the frequently asked questions section as one of the responses. So
I can say something about that. So basically the last 3 days is the very same. It's the day of death. That certainly counts, the day before and 2 days prior. Visits made after the patient has died, however, do not count. So they're visits that were made prior to the actual death.
In the frequently asked questions, it's question number 5 that Brenda went over earlier.
Thank you both. The next question is from Loretta. Anticipated date of hospice cap star rating and which measures are being considered toward the rating?
So for hospice caps measures, we would be looking to doing the star ratings no sooner than fiscal year 2022. And the details of that would be through the CAPS team lead is Deborah Dean Whitaker, and she would be providing more updates about that for the star ratings.
Okay. The next message is from Catherine. Claims data will be limited to Medicare fee-for-service encounters. No way to include Medicare Advantage data. Is this correct?
Can you repeat that question, please?
Sure. Claims data will be limited to Medicare fee-for-service encounters. There is no way to include Medicare Advantage data. Is that correct?
Well, just to be clear, that in the way hospice works, and I'm sure most people on this phone are aware of it, that Medicare Advantage patients, once they select the Medicare hospice benefit, become part of our fee for purposes of the hospice benefit are now fee-for-service beneficiaries. They still receive Medicare Advantage for things outside of that original Medicare doesn't cover, or things that are unique to their Medicare Advantage plan. So those patients are captured in our claims in the sense that they are in our they're part of our Medicare. They're now part of Medicare fee-for-service. So and separately, for what I was saying earlier, we are starting to show for information purposes which hospices accept Medicare Advantage patients, which is something we have access to in our public use file, and we're sharing it on Care Compare beginning in May of this year as part of information hospice users of the website would have access to.
So another question from Stacy. If the HOPE tool measures throughout hospice care, will there be another document that will have to be submitted to capture this information gathered at times other than admission and DC?
So when we moved to HOPE through future rulemaking, and it's finalized through future rulemaking and is part of the Hospice Quality Reporting Program, we would have the HOPE instrument as the tool used to capture all data, whether it's at admission or any period, any time point throughout the hospice stay, including discharge.
The next question comes from Judy. Are you going to be looking at the length of time the visits last related to quality?
So I assume the person means like how long we're looking at nursing minutes or things like that, and things that we can pull from claims data, and would we be using that as part of quality? What I will say is that as part of the development, and if you look at the proposed rule this year, as part of the development of the Hospice Care Index, some of our indicators do look at, visits within, nursing visits within 7 days and things like that. And so, I mean, it's in there. If you look at the details of that measure on our proposed rule for fiscal year 2022, you'll probably see some things about that. And for future claims-based measures, if there's ideas people have looking at length of time, we'd be interested in hearing your ideas there.
And it looks like we have one last question from Catherine. Any plan to stop requiring the rest of the discharge information, not just from Section O, since the rest of that information is available through claims data as well?
We appreciate the question, and for purposes of, as I was saying earlier, for record matching and other purposes, we still need to collect the discharge assessment. So we will continue to collect it. Thank you.
And I'm not seeing any other questions coming through the phone line. Here is a question from Chris. When will HVLDL performance data be available for agencies to see? We need to see our own performance and the national average performance in order to determine if performance improvement strategies are needed.
Sure. So the beginning of when we're showing that data corresponds with our plans for public reporting. So if our plans for public reporting are for May of 2022, and like any other measure that we bring on new, we've obviously going backwards in time. 3 months prior to that, we included in your preview report, and 3 months prior to that, or 6 months prior to public reporting of the information, we put it in your quality measure report. So if we're planning to do May of 2022 public reporting, we'd be looking at November of 2021 when you would be seeing it in your quality measure report and have access to looking at that data at that time. Thank you.
Okay, this next question is from Carol. In regards to last days of life, 3 or 7 days?
Okay, so Carol, you're correct. In the measure we have in our quality program, we work with 3 days. I think the reason you're talking about 7 days is because in the service intensity add-on, they look at 7 days. So while both the service intensity add-on and the hospice visits last days of life measures both look at RN and medical social visit visits, the time frames in service intensity add-on are in the last 7 days. And when we were looking at it as a quality measure, so that's their purposes for payment policy. When we were looking at it in for quality measure purposes, we identified that it's the key time for making those visits are in the last 3 days of life. And that is why when we specified the measure, we used 3 days, whereas our colleagues in payment policy, for purposes of receiving credit under the service intensity add-on, did 7 days. But when we did our analyses, the key time we identified, and again, when you look at this information on the technical report that's on our website, it's very clear that those last 3 days are the key times, and that's where we specified the measure that way.
And I don't see any other questions from the phone, and not from the question and answer panel either. So let's go ahead and wrap up at this time. We will review any additional questions and make sure that we get those answered for you. At this point in time, I'd like to thank our presenters for sharing their knowledge on today's webinar. This concludes the Changes in Hospice Item Set Guidance Manual version 3.00 webinar. The webinar slides presented today, which include the answers to the polling questions as well as the recording of this webinar, will be posted to the HQRP website. Once posted, we will send you an email notifying you where to download the materials. Thank you all so much for attending and enjoy the rest of your day.